over to you.
Yeah, I'm just going to share my screen. And hopefully people can see this. So I should start by saying I'm an astronomer by background, not a geographer. Although I will flippantly say that astronomy is a little bit like geography, but looking upwards. So there's a lot of concepts in common with coordinate systems and things like that, and splitting things up into areas. Anyway, over the last few years at ODI Leeds, working on various data projects, I've had to try and get my head around quite a few UK geographies, and they are very complicated, a lot more complicated than everyone often seems to present. This picture here is from the ONS. There's a, if you click through to it, you get a slightly bigger one. Hopefully, can people see my screen? No one said they could.
I can see.
Good, right. So this gives you a little bit of an idea of how complicated UK geography is. It's more complicated than this because not everything is on here. These are things that the ONS has put together. So one of our problems we have is we've got lots of different geographies. There's necessary reasons for all of those. But another problem we have is that the boundaries of them don't necessarily match up. And the different colours here give you an idea of some things that don't necessarily match up. If I go to our data mapper, so we at mapper.odilleeds.org, we try to visualize data sets on Datamill North, Calderdale DataWorks, York Open Data and others that are geographic data sets. We've got a few boundary ones here. These are local authority districts. There's probably people from local authorities here who recognise it. I'll zoom into our part of the country because Leeds, Harrogate, Bradford is a good area that crosses county boundaries, crosses local authorities, and has various bits of overlap. So just to give an idea of the shapes and sizes of some things, so local authority districts, these are our local ones. This is Leeds that I've highlighted there. This is Harrogate and Bradford. If we look at postal districts, this has been relevant recently with the NHS 111 data, which I'm sure people go into more detail later. If I zoom in a bit on this Leeds-Harrogate boundary, this one that I've highlighted here is LS17. That is in 2 local authorities and 2 different counties. So some of it is in Leeds and some of it is in Harrogate. Admittedly, there's not a huge number of people living in this chunk that's in Harrogate, and it's dominated by the Leeds chunk. But it means that if you've only got data to for your postcodes to say LS17, it's very difficult to know how to split that into local authorities. Wards, I'll switch to wards, although that's a very big file, so that might take a few seconds to load in. Wards often, although I don't think they necessarily always line up with local authority boundaries, and they can possibly potentially cross. I get confused because every year as well, things are rearranged. So it's important to know which year you're talking about with a geography. Now, if I switch off wards and go to clinical commissioning groups, some data has probably been reported by clinical commissioning groups. The NHS 111 data is aggregated to clinical commissioning group. And this is what they looked like in 2019, if I turn off local authority districts. So you can see Leeds happens to be a CCG that is the same as Leeds as a local authority, but Bradford in 2019 was split up into 3 pieces. There was Bradford City, Bradford Districts, and some of Bradford was in NHS Airedale, Wharfdale and Craven. In April 2020, which is unfortunate timing given the pandemic, things were rearranged. So Bradford now sits in this much larger CCG. So if you're reporting data, one thing I would ask is that you mention which year's definition, and possibly month even, of definition of geography it is that you're publishing, because things can be very different from year to year. And sometimes things keep the same name, but then change the boundaries and might not have the same overlap. Anyway, our data mapper has quite a few of these things. You can just easily add new layers, and there's a big search thing here if you want to see some things. But another tool that I would definitely recommend is the Office for National Statistics GeoPortal, which gives you all sorts of geography files for all sorts of things, and it generally has all the different versions of, say, local authority districts for each year. It's got quite a lot of things on it, so finding things can be quite tricky sometimes, but that is the definitive place to go look. And I think I'll stop because I'm probably saying things that other people are going to be saying.
Thanks very much, Stuart. And one of the reasons we wanted to share that was just that we share your pain, we've been there, but also the way in which we have, so there's a geographies page on the ODI Leeds website where we've talked about what we've done before, how we try to manage that, and also the ODI Leeds mapper, which that's a tool that's open, anyone can use it, and if you're trying to demonstrate quickly to people, all you need is a web browser. You don't need anything else. You just access that, and you can show people very quickly how difficult geography is. And I've definitely found that very useful in meetings, just to explain to people that although people might think that geography is just a hygiene issue that we need to we can pick up during a project, it is something that absolutely needs to be talked about upfront in projects, so that we don't fall foul of it in the future, and it can create problems and people's expectations. It's always really good to manage people's expectations of what you can and can't do with geography in that. So
there's a question from Hannah about postcode sectors.
Yes.
They can still overlap. There is no, the Post Office or Royal Mail created postcodes and boundaries, I guess, in a way. Local authorities assign them now, but that's completely detached from any other reasoning for local authority boundaries. It's based around the mechanics of delivering mail. So there's no reason for anything to overlap. Even an individual postcode doesn't have to only be in one local authority. Often even the ONS will publish a data set which gives you a centroid for a postcode. But if you go into their methodology, as they have to explain, a postcode is an area, not a point. And that area can overlap political boundaries, but they've taken the middle point of that and assigned it to a local authority. So when you use the lookup tables to get from postcode to anything else, there's always a level of approximation going on, because fundamentally a postcode covers an area, and also the same postcode can cover, different postcodes can cover the same area, because a building can have multiple postcodes. So there's a lot of complication in there, and everything is always going to be an approximation to some extent. But obviously, if you get down to the full postcode, you're much more reliable at knowing which local authority any individual's address is likely to be in. But fundamentally, if we had UPRNs for everything and Ordnance Survey published all that as open data, some of this would disappear.
Fantastic. Okay. So hopefully people understand what we're going to talk about today. And if you are in the right, you're on the right Zoom call, if you want to talk about that and find out about this. So strap in, and we're going to go next to Jessica, NHS Digital, and you can talk about your pain over the last 2 or 3 months and how we might be able to help and that sort of thing. So over to you.
Paul. Thank you. Morning everyone. So basically at NHS Digital, we've definitely identified that there is a need for more information around our geographies. We know that they're very complicated. We've got so many CCGs and even more local authorities. And what we'd love to get out of today's call is to know how that you're tackling them, what kind of tools you're using, and what are those like real pain points that hopefully we can kind of expand your knowledge on in the future. Especially at the minute with our release of the COVID data, it's more important than ever. And we know that there's no clean mapping from a 4-digit postcode to a local authority. Just any of your tips and information that you have to offer would be greatly appreciated. We've got Alistair on the call as well. He's a product manager for Open Data. Have you got anything to add, Alistair?
No, not really, except, like Paul said, it comes up again and again and again in our open data sets. And I guess I'm quite keen for some collateral wherever that sits that we can point people to, both internally and externally, to educate them on how to analyse the data. And I think with the COVID response, it's becoming an increasingly common question because we're clashing together data sets from various places, so 111, testing, and cases, for example. I've been on a number of calls this week trying to bring those data sets together. So some kind of blog post or something at the end of this would be fantastic, that we can say, here's all the smelliness, and then we don't have to explain it again and again and again.
Fantastic. Well, that's I think our initial web pages are a start. I think we'll write this up as a blog post, and then it would be amazing if this group could then make some recommendations based on, you can't say we can't do it because of reasons. We need to fix this. And here's the way we're going to fix it. And it will be an iterative process. But if we do it collectively, we will get there quicker and faster. And we can also moan at the Geospatial Commission and say, look, you have however many hundreds of millions of pounds that you're supposed to be deploying. Stop trying to protect the OS's business model. Start trying to fix problems and save lives. So I'm quite passionate about that. And there are pots of money we can access. So let's start that. So there's a definite requirement from the NHS and NHS Digital. They're committed to help us with this process. We're going to help steward that process through and convene. And I'd now like to move over to Dan, who's going to give us a talk about geography. And I haven't seen this, but I'm looking forward to it. So over to you, Dan, and welcome. You're on mute, which I've not said it yet, but yes, we said it. Yes, you're on mute. Over to you. Dan, you need to unmute yourself. Bottom left.
Unmute. Is that good? Excellent. Okay. Thanks for that, Paul. Hello, everybody. Nice to see you, Bob. It's been a long time. What I'm going to do is just run through a couple of maps I've been sort of playing with. I'm a housing market analyst, so this is not my territory in terms of health data specifically, but I do have some background in obviously mapping health geographies. I am an independent sort of freelancer. I do get commissioned occasionally to do stuff with health geographies, and I'll touch on that. I pulled a very quick slide deck together, which I can share with everybody. So I'll share screen if I may, and hopefully find my presentation. So if I share, can you see that? Yeah, thanks, Paul. Okay, I'm going to really fly through a few things. As I said, I'll share this. There'll be links to some maps. Tiny bit about me. Trained as an architect before computers. Got out of it in the early 90s because I realized I wasn't going to be any good at it. Got into business and research and became aware of GIS maps. This was 94, 95. Decided I needed to buy a license for MapInfo on the Mac. This is really early days. Even got invited to teach some students at Dundee Uni, which is always a good way of learning. So I was about 2 chapters ahead of them, but got fascinated about what you can do with these tools. And the housing market was one area I was looking at closely. Ended up getting a job with Scottish Homes, which is a housing agency in Scotland, who had huge resources and great GIS, and had a chance to do some interesting stuff with housing data. Met Bob Barr, and we might even be able to talk about that at some point, but had some fascinating insights into what was sort of bleeding edge in terms of GIS. So that's web-based mapping in the sort of mid-90s. Left there to set up a consultancy called See It. But probably more interestingly, I then set up another business doing stuff with house price data. This is before Rightmove and Zoopla were on the scene. It's basically releasing the land registry data or getting it out so people could find out what their neighbours had paid for their house. And that was an interesting journey. It was my venture into the .com world. So myhouseprice.com was created, and it actually still exists as a small business servicing the requirements of surveyors in Scotland. But at the time, we were the first to get all the land registry data onto a server, a private server, and serve it up in various ways. So I was pleased with this map. This was a data zone level mapping of house prices across the UK. So we were early into that. So since then, that's the wrong slide. I'm now independent, doing much more stuff on the web. I do everything on the web in terms of mapping. this is actually an example of a map I did for a client, Centre for Progressive Policy. This was last year, looking at fragmentation of health boundaries. I can share the link to this. In essence, they're complicated, very complicated, but they bothered to try and represent that on a map, and I've got a carto map which we can have a look at. But the main sort of topic I wanted to really touch on was the COVID-19 data. I've been sort of mapping it just out of curiosity. Yeah, I wasn't commissioned to do this, but this stuff is important. As Thomas, you know, anybody that's looking at this granular data is coming up against very interesting sort of issues about geography all the time. So what I've got is an interactive map, and I welcome you to sort of go and have a look at that. If you go j.mp/COVID-19 population density map, what I'm going to do is actually just go into that map, which you will be able to do as well, just so we can consider what data is actually there. Those blobs are the COVID-19 deaths at the MSOA level. So these are using the centroid of the MSOA, which ONS provided. And if I need to move my screen over, bear with me, because I'm just having issues with my windows. Let's get Zoom chat out of the way. So in essence, we know, I'm using Carto here, one of my favorite web-based mapping platforms. Very quick to share map. And we're getting a sense here of obviously where most of those COVID deaths are concentrated. But clearly that's just points on a map. There's so many other issues related to that data. And if we zoom in, let's have a look at, say, Birmingham. Other maps that I've created in the past include population density. So let's have a look at that as a grid. We can bring that in really nice and quickly. Just start exploring. This is really what I was using it for. Seeing how layers interact or don't, different geographies. We can look at things like, rather than the points, we can look at the rates. So I could turn on COVID rates and turn off the population grid, obviously, and just start playing around with this and trying to understand what's going on, because it is going to be one of the, you know, it's the biggest topic, spatial topics of our time. So I can't say anything. I can't say what this means. All I'm trying to do is see patterns by mapping the information. If I put on deprivation, I know Tom Worth at ODI did some really interesting analysis using the deprivation data. You know, we can start seeing some of those relationships quickly. I'm not to say there's causal relationships here, but it does help to be able to map it very fast. Take off deprivation and then maybe look at where the care homes are. You know, that was obviously something that was possible to spot early on in the data, that care homes was an issue. Certainly in Scotland, where at 1.60% of the deaths were happening in care homes. So again, this is open data that Geolytics actually provided. So these dots, I'm clustering them here. I was trying to get a sense of, you know, were there high concentrations in relation to where the care homes were, but they're only postcode based. So that's on there. Take the care homes off and maybe have a look at household size. Obviously, there's been a lot of talk about ethnic minorities being more likely to die of COVID. I happened to just pull off the data that was persons per household, because that might have some issue, or might be an issue. Again, this is me just visualizing. I'm not actually doing any further analysis, but I do think it's a very powerful way of getting across lots of information. So if I click back to the, so that's the map. Another, bear with me, I've jumped way ahead. So we have the map. Data on total deaths is obviously a very interesting topic, a key topic, and I've actually been much more interested in excess mortality, also actual date of death. That's really very important. This is a chart I actually pulled together last night after watching Newsnight, because the numbers actually of actual deaths per day are the blue line. The red line there is the registration dates, and you can get a sense of what's going on. Obviously, that line is looking like it's going down nicely, so hopefully we are actually at this point in time, we are actually on the 3rd of June, 4th of June here. So whether that line actually is there now, we will know in 2 weeks' time. So these are big questions. Scotland is the same. I won't dwell on these charts, but in essence, it's me tracking that data in detail. Another very quick look at the Google mobility data, because that is absolutely fascinating. Mostly because it's so granular in the UK. We're fortunate we've got breakdowns here which are much smaller than they are elsewhere, I would say. And the ONS have done some great work pulling the geographies to match the sub-regions that Google use. And I can share, I had to do a bit of tweaking to the code or the naming so that we could actually map that data. So in essence, this is really very, very important, I'd say, to understanding both how we went into lockdown, but also how we come out of it. So I think I'll wrap that up there, and we'll be happy to share or take questions.
Fantastic, Dan. That's great. People are making comments in the chat. I think for one of my, I'll ask a question first while other people are thinking of them.
Yep.
The granularity of the Google data is great, and it's also in an easy to use format now that ONS scraped all the PDFs and presented that.
Absolutely.
We're going to do a session next week, just so everyone knows. Open Data Saves Lives next week will be about local data for local people. We've been ODI Leeds looking at what data you can get in Italy and France, and you know, if you were going to look at an index of if I was an interested party was to look at some data, you know, for example, in France, I can see in my area the number of hospitalizations for COVID is down to, you know, single fevers per day. So that I can relax a little bit there if I live in Bordeaux, but I have no idea of any sort of data at a local level. You know, have you seen anything that could allow you as an interested party to start making a view about whether you should be very concerned about COVID or a little bit, or actually quite relaxed?
I've swung many ways over this lockdown. Pre-lockdown, I was too sanguine, and then I swore that I wouldn't get involved in looking at the data, but I couldn't stop myself. One, because the data became better, because there was more granularity. Certainly when ONS published the MSOA level data, I thought I have to look at it. I do need to map it because I can. I want to know what's going on. There's a gap there, in as much as in Scotland we didn't get that level of granularity. But I think what I've discovered, you can go too granular. Sometimes those trends, which I've mapped, you know, that chart of understanding what the data is actually telling us is key. You know, and a registered death isn't the same as the occurrence of a death. And that's going to come out, because I know Newsnight last night was bigging up this number of UK registered deaths on a particular day in relation to the rest of Europe. But if we actually consider what the actual deaths that occurred yesterday were, we won't know that for 2 weeks because they take the time to be registered. But given, I mean, I can go back to that line, you know, there's a line that is going down nicely. Hopefully it doesn't pick up for whatever reason over, for whatever reason. But I'm hopeful now that we're at a good, yeah.
Okay.
The deaths are stopping basically. So that's my sort of little insight.
Fantastic, but the local data just isn't there really at the moment. You're saying.
No, no, it's not. So that would absolutely help at the local level to sort of reassure. Yeah.
Fantastic. All right. So yeah, we're going to combine with some testing data. That's absolutely. Okay. So if people want to continue putting some questions in the chat, that's great. I'd like to thank Dan personally for joining us today, or on behalf of everyone, to say thanks very much for your input there. Obviously, if you want to use Dan's skills in the future, anyone,
yes.
you now know where he is. You now know where he is. So yeah, thanks very much, Dan. If you can stop sharing your screen.
Sorry, yeah.
That's all right.
Hogging the screen there. Yeah.
Yeah, and put yourself on mute. And then Bob, are you with us? Oh, you're on mute.
I'm not on mute anymore.
Fantastic.
That's
it.
I'm just going to do a talking head piece to you rather than showing you anything as wonderful as Dan's maps. And I'm really here to ask you a question, which is, why has the most obvious solution to many of the problems which have been described by the previous speakers not been considered seriously in the UK? Imagine if you had some data that is widely available, that applies to everybody in the country, that could ensure that fire, police, ambulance could get to victims or people making a call immediately. Imagine if you could reduce air pollution in local areas because the last quarter mile dithering that everybody's used to in their cars would have a technical fix for it. Imagine if the amount of air pollution that you could get rid of. Think of all the lives that you could save. And we know you could save lives because certainly every few months a local newspaper has a story of the ambulance or fire engine that got lost, couldn't find a property, and as a result somebody died. And one of the things which I find staggering, because I've spoken to people who deal with the ambulance arrival statistics, because ambulance services have an 8-minute target for arriving at destinations. One of the things that is not recorded is how often ambulances fail to meet that because they cannot find the address to which they've been dispatched. So the key to all of this is address data. And it's address data that's geocoded down to individual buildings and to individual property parcels. Because on the whole, administrative boundaries do cross all sorts of other boundaries randomly. The problem with postcodes has been very well described, and that's because postcodes are there for one purpose, administrative boundaries are there for another purpose. Wards should not split across local authority boundaries because they are electoral units for those authorities, but nevertheless, there are constant errors in this data. I'm a visiting professor at Liverpool University. I spent 30 years teaching GIS and running a GIS lab at Manchester University, which was then spun out into a company called Manchester Geomatics. And one of the things that we ran as our very first commercial project in Manchester Geomatics was something called Joined Up Geography Testbed. And this was sponsored by about 10 national organisations, commercial organisations like Esri, the Office of Deputy Prime Minister, now MHCLG, ONS, Ordnance Survey, Royal Mail. We got everybody with the core geographical data around the table to say, let's do some quality assurance. Let's see whether this data fits together. And what emerged from Joined Up Geography Testbed, it couldn't have been done in an academic setting, it could only be done in a commercial setting because it was all confidential to the organisations, was that we discovered an awful lot of dirty linen. The quality of the data sets was extraordinarily bad. That at ED level, ONS were failing to allocate addresses for sometimes a 10% error level. This didn't surprise us enormously. We've got Robert James in on this call today. Robert, some of you may know, was responsible in the post office for getting the postcode address file onto CD-ROM in the first place, and my lab in the university was one of the first customers for that. At that stage, a precursor to NHS Digital ran a directory of NHS points of interest, such as doctor's surgeries. So one of the first things we did was to check the doctor's surgeries address list against the postcode address file. 10% of the doctor's surgeries on the NHS list had postcodes that did not match those that Royal Mail reckoned they ought to have. And those errors are absolutely constant. We completed the Joined Up Geography Testbed project. We demonstrated to Ordnance Survey that Address Point, their key geocoding product for addresses, was faulty. They started off by calling us charlatans, by saying we'd taken their money and told them a load of nonsense. This couldn't possibly be true. They came back 2 weeks later and apologized to us, and they said, it's not just bad, it's worse than you told us it was. Of course, this is all very trivial. Now you've told us, we know exactly how to sort it, but we haven't got the resource at the moment. Would you sort it? And it took a lot of sorting. Unfortunately, somehow Ordnance Survey managed to forget that sorting, because 10 years afterwards, at a presentation where the ODI were present, the address manager of Ordnance Survey very proudly said, oh, we've just sorted geolocating our address points because they were really bad. Well, it had been sorted 10 years before. They threw away the results, and then they had to rediscover that wheel. All of this came to a head in 2001, when the 2001 census was based crazily. Now, no one can imagine why anyone would do this. The 2001 census was based not on PAF, as was stated. It was based on 1999 address point. And the idea was that enumerators were going to fill in the details afterwards. They were going to be able to find properties. Lo and behold, 2002 November, Manchester City Council were going to be clients of ours for a part of the Joined Up Geography Testbed project, and they rang me up and they said, Bob, you know we were going to sponsor Joined Up Geography Testbed project. Well, we've got a much more urgent problem. We've just had our census results. The census says that our population dropped by 40,000. It can't be true. Council tax hasn't gone down. Number of patients registered at GPs hasn't gone down. Pupils in schools haven't gone down. But we've spoken to the national statistician. He says this is the most accurate census ever. It's the only census that's ever been double-checked by a ground survey. You're wrong, we're right. So Manchester said, well, what if we got an independent audit of our results? And because they were talking to us already, they came to us and they said, will you do an audit of our address evidence to present to ONS? And we were extremely fortunate because at that stage, John Fullinger, who became national statistician, had been made director of the census. And he said to Manchester, well, we probably won't take any notice because we know we're right. But just out of interest, who do you use? And they said Manchester Geomatics. And they said, never heard of them. And he said, Bob Barr's outfit out of the university. And he said, well, if it's Bob Barr's outfit, I happen to know John Fullinger from 10 years previously when we'd both worked on the social exclusion unit. And we'd worked on the Better Information Policy Action Team, which had led to neighbourhood stats. He won his battle over neighbourhood stats, and I helped with that. It won a battle to improve the index of multiple deprivation enormously with the Oxford team, but I lost my battle over making sure that we should be doing all our georeferencing at individual address level. And ONS, and the Geography Division ONS, said, no, we're entirely happy with doing it at postcode level. And that led to continuing problems. The end result of the 2001 census work was that we were able to demonstrate to the satisfaction of ONS and the Statistics Authority and a whole raft of peer reviewers that ONS got it badly wrong. And the places like Manchester had been under-enumerated very significantly, perhaps not quite by 40,000, but very significantly. The end result was that Manchester had its population estimate changed, which generated £10 million a year over a 10-year period, £100 million for Manchester £2 million a year for the clinical commissioning groups, 20 million over a 10-year period. So this addressing stuff really matters. My puzzle now, and what I'm asking for help from all of you, is I know that the ODI knows this is really important. I know that the ODI went and spent a lot of money trying to produce an independent open address register, and in the end had to throw in the towel, as has everybody else who's had to create an open address register, because of the legal impediments. And the legal impediments are there because Royal Mail and Ordnance Survey want to keep a bait and hook commercial model. And the reason this is important now is we're going to be told that everything's going to be fine because UPRNs are going to be open, and there will be a cheap address product from the 1st of July, which is going to be address-based core. And my view is that simply is still not the right answer. An open national address register is the only right answer. And a question that I keep asking, both as a politician, I lead Liberal Democrats in Warrington Borough Council, and as an academic, is how did we arrive at these decisions? And we don't know. That part of advice from ministers is secret. I have some fair ideas. I've got some suppositions which are in the PowerPoint presentation that you're very welcome to download on the great data robbery. But we must carry on asking that question, and we must particularly keep challenging the Geospatial Commission as to why they are sticking to a model, particularly now that they've funded Ordnance Survey over a 10-year period to the tune of about £1 billion, which would be enough to make Ordnance Survey into a fully open data organisation. Yet they are determined to make it a bait and hook commercial organisation and to keep it as such. And we need to keep challenging that. Only that way we'll be able to improve our data at individual atomic unit level, and those atomic units are addresses, and UPRN's not an adequate substitute. Thanks for listening.
So I have a feeling that we should give you a round of applause or all stand up at this point, or you know. But yeah, from putting addresses on a CD-ROM to fixing Ordnance Survey's broken business model. If we can put, there must be lots of questions for Rob, but I would like to ask one of the people who was involved with the ODI's attempt to fix addresses, who I can see there smirking in his orangery. Peter Wells is on the call. Can I just ask for you, Mark, if you could just, Peter, if you could just give us your point of view, and then maybe we could all discuss about how we might approach fixing this problem.
Cool. I don't smirk, it's just my normal facial expression. So people who don't know, I was one of the two people running the UK's project to build an open address register. I also helped stop the land registry privatisations. We thought that was going to go the same way as Ordnance Survey, that was privatised. And did some work on the Geospatial Commission up to the end of 2017 when I stopped working on that. So as far as I can, so the reason ODI stopped with the open address register was because we could not get insurance. So that was the fundamental problem. There was only one company willing to, we could see that we could build an open address register, and it would probably take a couple of £1 million to actually build it and get it sustainable as an institution. But only one organisation was willing to insure it. And that was an incredibly high, both in high insurance premium and high conditions, because of the fear of litigation, whether that litigation was well-founded or not. So the fear and cost of litigation. So it was just too hard to do, so we passed it back to government then. The fundamental problem, as Bob said, is the business model of the Ordnance Survey. Royal Mail is not as big of a problem because the money that they make from it is reasonably well known. It can be challenged, but it's reasonably well known and has been dug into. The fundamental problem is the business model of the Ordnance Survey. The way to stop that is the way to change that is it needs a cross-party campaign. So the Geospatial Commission, I didn't work on it in 2018, 2019, other ODI people did. It was Lee Dodds leading that work. The way we stopped the land registry was a cross-party campaign where we pulled together enough evidence, we got enough people together, and we got politicians, trade unions, activists, businesses, civil servants, local authorities, all calling for it to be different. And that was what made the change. Ordnance Survey needs the same thing. It needs a campaign approach rather than what I fear we're in, which is this incrementalist approach around things like, as Bob said, UPRNs and interoperability and standards. And that's only going to get us so far. It will weaken the monolith, but it won't change. Other countries, France, radical change, Denmark, radical change, Australia, radical change. That's what the UK needs. That's the only path the UK needs to do. The only path the UK has left, in my personal opinion. And I have utmost respect for pretty much everyone I've ever met at the Ordnance Survey.
Fantastic. So I think, obviously, hashtag radically open. We're all for radical change, but Peter, your insight on that is really welcome. I don't think we're going to fix Ordnance Survey's business model here on this call. However, I think for people who are new to this or have discovered how difficult things are or unnecessarily difficult they are, we do have a chance to say that if we'd had open addressing at the start of COVID, we would be much further along and we would have saved more lives, and there would have been a more effective communication of the data and also a more effective response to COVID, especially at local authority level where health and social care have come together. So I am determined to finish this under the hour. So we've got about maybe 10 minutes to go through this. So we're going to write this up. We'll take your comments on board. Bob's Great Data Robbery PowerPoint will be linked to in the write-up, as will Dan's demonstration. There's a specific request there from NHS Digital, which is how do we help them link their data to geography at different levels? So I think Alistair and Jessica, a question for you really is, how can we best help you? What do we need? Do we say, okay, let's learn from the 111 data publishing where we couldn't really link it back to local authority level because we threw away the data before we published it? And I don't mean throw it away, but because of anonymization, we
throw it away. We collect it for telephony. So
did we throw it away?
Yeah. It's
okay. Is it anonymized and thrown away?
My understanding. Yeah. So we're still unpicking that.
Yeah.
I mean, hopefully, let's be pro. What could help us? I mean, I think when we're building new systems, and we're kind of building a lot of new systems at the moment, potentially uplifting old ones, something to pinpoint the value of holding, for example, the entire postcode and not losing the last 4 characters, or something to help make that argument. Right? I know it sounds silly, right? But if we can point external and it's not just me, that's good, right? Do you see what I mean? So I think just having some external, not pressure, but some external I can point at that could be helpful for future things. So that's one thing, and then I guess the other thing is we've got we're putting more COVID open data into the open domain. We've got a backlog that we're working through. I'm hoping to get some more data sets out. I guess it's how there's a lot of challenges on linking that together, but we are where we are. So what workarounds and assumptions can people make to link that data together? So for example, if we're, clashing together local authority and CCG and we're having to go down to UTLA, it's like, I think a lot of that knowledge, and certainly in Stuart, you've been really helpful in the way you've had some calls with, with some of the consultants that are helping NHS Digital and ourselves, is getting that written down so that people can see it's complex. I think we're wasting a lot of time. Certainly, I think we've wasted some time with some of the COVID dashboard work I've been involved in. Is people think it's simple, they crack on, it goes in the project plan, and then it all just runs into mud. And that's certainly happened, I think, with at least one bit of analysis. So just exposing that pain and us being able to point to it is valuable, I think. And then in terms of like the fundamental change, and I'm not a geography expert at all. Anything we can do to support that in terms of impact statements and stuff, or how that's making stuff difficult for, happy to feed into, really. But that sounds very hard. Does that make sense? I guess there's 3 things. So help us make the case for capturing more geographical data where appropriate. sort of understanding, sort of just exposing the complexity and some of the assumptions and workarounds you can make is massively helpful. And then really happy to feed into the broader strategic fixes. And if you need use cases and stuff, I'm happy to work my way around the organisation to dig those out. So the ambulance waiting time and stuff, I've got people in that analytics team. Does that make sense? I mean, that's sort of
no, absolutely, and it's really good to hear that. This is amazing. Who'd have thought 2 years ago NHS Digital will be on a call with loads of people they hadn't met before, talking about the problems they've got and not worrying about.
No one's sacked me yet, but we'll
no,
see.
exactly. Well, we've got a little bit of cover from Tom Denwood, haven't we? So
absolutely.
That's good. So I think what we'll do, I think. We're going to write a blog post, but we'd like to get everyone in this call involved in. You've signed up through Eventbrite, so we've got your email addresses. What we'll do is we'll all link you to a Google Doc that we're putting. We'll start writing this up, and then we'll ask for your input. And then, Alistair, if I could ask you and Jessica to do a guest blog on our Open Data Saves Lives webpage, we can add the thoughts of this collective onto that. And I know other things are happening across the country as well. We'll share that with them. And then for you to say, look, we're trying to fix this, we're trying to help, and we're trying to, if this collective can say, look, when you collect your data, please don't throw away all of the data before you've anonymized it, because then we can go back to it and we can actually make it useful and connect it to local authorities, because it's okay giving data to a local authority at CCG level, but then it's, I'm sure Graham on the call will say, well, what use is it to him if he doesn't know if someone's in Harrogate or Leeds? That's crackers, isn't it? So we'll write that up, and then I think we will get a guest blog post from NHS Digital about geography. And then I think it's for all of us to start sharing that with everyone we meet, or pointing to it and saying, at the start of a project, geography is hard. And then I think we can think about the comms on this. If somebody from the visualization team at Goldman Sachs wrote a little blog post and shared back what they did with the information they've got from ODI Leeds, and here's a little story of technical blog, that would be really useful as well, because I'm sure they'll say at the start of this, we started to visualize it, we thought it'd be easy, and then we talked about geography, and it was like, oh my god.
Yeah, and I'm sure they'd be happy to do that, because I think they're really good guys at the Goldman Sachs people we're working with, and I'm sure we can get some cover to make sure they could publish it, because I think that is it was a classic kind of just running into that brick wall of complexity, and they're clever people, right? and they just didn't, and then it just got harder and harder.
Yeah.
So I think that'd be really good. Yeah, that'd be really cool to get them involved.
And then to Bob's point about what we do, and Peter's point about how we collect this is dull but important stuff, and we need to find a way of making that important. And your point, Bob, around maybe we need to ask NHS Digital if we can get the number of misallocated blue light calls somewhere as a data set, and we start collecting that, and that becomes a stick to beat ordnance survey up with. So look, here we are. Here we have a thing where open data saves lives, man. So maybe there's something on that we can do.
Yeah, I'm wondering if that data sits anywhere and whether it could potentially be open. Because I don't know if it'd be the ambulance authorities or whether it'd flow. I'm not an expert in that area, but I can ask. Yeah.
Okay. What gets measured gets done, isn't it?
Absolutely.
Yeah. Okay. So we've got 6 minutes left. I've talked too much. Would anyone like to make a point? Either raise your hand physically, or on the chat, or in the. Dan's got a point there to make. Anybody else would like to make a point? Robert would like a point. So we'll go to Dan, then Robert. Dan, take yourself off mute, and then. Yeah.
Thanks, Paul. Yeah, no, it's just fascinating. I just put it in the chat that the postcode districts are actually a layer on that interactive map, and obviously MSOA boundaries are there, and the deprivation layer is at LSOA level. So you've actually got a nice way of visualizing the relationships and the local authority boundaries. So if you really want to have a play around, just change the layers, take off the stuff that gets in the way, and just explore the boundaries. I probably shouldn't be doing the postcode districts being mapped are actually quite high resolution ones, which had to be licensed. but they were because I needed them for a project that needed them to do that job properly, to actually allocate postcode districts to government regions, and then figure out what to do with the ones on the boundary, because there's plenty of them. But anyway.
Really quick question on the demo you did. I thought it was amazing, really good. Are there platforms where we could bring in data that's aggregate, but probably we wouldn't want to put in the public domain yet? So I'm sort of thinking things like testing, for example. And we, it's 111, sort of 999 calls at different resolutions, because I think that could be the stuff almost prior to it being open could be massively useful, sort of combining that private data sets and open data sets in that map. Because I think, people are asking those questions, of course.
I put a lot of the stuff I do behind passwords. I mean, ultimately, I've just shared an embedded map using the platform, but I can put it behind a password. I don't know how secure that password is. But in essence, you can throw data together quickly. I mean, that's why I use it. But yeah, and it's all about how you anonymize and aggregate. So the choice of aggregation of point data, location data is the key. But obviously, as Bob, there'll be many ways of anonymizing that
we can.
Dan, I'm gonna convene, because my target of doing it under 0 hours. But Dan will put you in touch with Alistair, and I'm sure there's stuff we can do there. And this is what Open Data Sales Live is all about. So we'll go to Robert, and then Mark's got a point he wants to make. So Robert, over to you.
Right, I think I'm unmuted now. Can you hear me? Right, great. A couple of points about postcodes. First of all, postcodes are not areas. They're simply lists of properties delivered by one postman on one street. Second point, when we created the postcode boundaries and sectors, districts were not related to local authorities, but sectors were. So sectors should map very closely to local authority boundaries for 1975 or pre-75. Not necessarily a help.
Oh, you're on mute again. I'll unmute you.
Do that. How did I do that? So clever. Because of the way that the system was set up, there is a greater degree of consistency between sectors than there are between districts. Districts can consist of 1 to 10 sectors, but sectors are all within quite a narrow range if they're real. So some points about postcodes. Another point I wanted when I ran the postcode system, postcode address file to be about a 5 now. I plan to give it away free in 1995 on the front cover of PC Pro, etc. When we were still doing CDs. Unfortunately, I left. A point which is currently I'm working for DEFRA. I'm being seconded to the Geospatial Commission to work on geospatial data file interoperability on a project they've set up. We are trying to be a major input into that, and I would be happy to receive advice about any open data files we can merge in that. Basically, we're going to start out looking at files which are publicly available within the Magic portal from DEFRA, and then spin that out wider to external data files. We're starting there because there are no GDPR implications. They're all publicly downloadable and can be replicated by other people. So anybody who's got something of interest which I can take, this project is not likely to help COVID. It's not really starting till August, and then it's running till December in the first phase. That's the end for me.
Okay, well, Robert, if you'd like to do a little guest blog post on the Open Data Sales Live or ODI Leeds website, we can put that request out to a wider network. So, Amy, if you could get in touch with Robert, we can get that done. Okay, we're nearly there. Mark, you're going to be the last point. Over to you.
Okay, thank you, Paul. I'll just be really quick. So, if this is about geography and to some extent about COVID, a lot of what we're looking at is those two issues within a building. So did the patient catch it off the drug chart or the cleaner or the ward clerk or the doctor that was working across 2 wards or the machine that transfused their blood and so on. So we've built kind of sat-nav capability within our hospital for people, say, that can't read or don't know their way around our hospital. So you can follow on your phone through our hospital. And all of that is the same set of skills that people on this call have got, building vectors, looking at maps, but it's within a building. So a lot of the data we've had presented should be about the risk of infection. Well, that needs geographical analysis within a building, not just the postcode to postcode. So it's just to mention that we're starting to do that, and if people are interested in that or can help, we'd be keen to hear from them. And that's linking staff data, Wi-Fi points, all kinds of things.
No, absolutely. That next phase of geography is definitely something we should look at, and I think it'd be really good to get a demo or a talk about that work, and share that widely, because that you are not the only people who'll be looking at that across the NHS. So maybe our local data for local people.
Yeah, we could do that if you want, Paul.
That's next week. Yeah, so local data for local people. You know how you do that, and then maybe we can push it out to all the people working in the CCGs. And maybe I'll post it on Future NHS and see if they want to join us. Let's do that. Okay, well, thanks very much, everyone. Another really useful, important part of the process. As I said, we'll be putting out the next piece around Open Data Saves Lives, which is all about what local data people need, what local data people need for next week. And let's give ourselves a round of applause and give especially Dan and Robert and Rob our thanks for joining us. And who knew we had the people who set up the postal address file in the first place. That's fantastic. So thanks very much, everyone, and we'll see you next week. Hello. What a great session.
Yeah, Patrick left.
Do you want to come back in, Patrick? What a great session.
Yeah, if you want. Yeah. I have recorded it.